it took COVID-19 for those colleagues and those policymakers to now go back to begin to lick their vomit. I am not embarrassed. My position has been critical. My position has been categorical from day one, despite the fact that I took my master's degree from the University of Edinburgh and my PhD from Leeds. Once I came back to Nigeria, it was very clear to me that unless we developed our own capacities to produce our own medicines, unless we develop our own capacities to produce our own vaccines, we were not going anywhere. And I've put all my views on record.
Okay, now that brings us to the conference. We've been following your countdown to the international conference on health access and socio-economic development beyond COVID-19. Tell us more about this planned conference. What are the issues you're targeting to address in the sector through the conference as well?
Yes, thank you very much. And I think that's a really good follow-on from the previous question, because in my engagement with top leaders across Africa, I found out that a lot of the problems we have in developing African interventions for African solutions is because our ontology and our epistemologies are wrong. Okay? And so we need to rejig how we think solutions should be provided. A situation where we sit down and wait for world bodies to hand down solutions to us. A situation where we sit down and wait for entities in Asia, in Europe, and in Northern America to hand down solutions to us speaks to our ability to believe in our capacities, right? And like I mentioned in the earlier question, when there were very few of us speaking about medicine security, we were vilified until it took something as disruptive as COVID-19 to come and show everybody that we were right. And that's the wrong way to go about it. We need to develop a more proactive way of addressing African solutions and addressing African problems with African solutions. And that is what this conference is all about. The conference, if you noticed, we very cleverly developed a framework where all thought leaders will come and sit at a table. We have very high-ranking government officials who are going to attend. We have policymakers. We have scientists. We have people in social sciences and even people in the literary sectors and the other sectors which traditionally were not involved in developing solutions for COVID-19. And we're calling everybody to say, NIPRD doesn't have the entire, even though NIPRD has done well in providing solutions for Africa for COVID-19, NIPRD doesn't have the entire answer to how knowledge is provided. Let's all sit down and begin to rejig how we approach solution making in Africa. That, in its essence, is what that conference is about. And I must commend the team that has been on ground. For you to have mentioned that you've been following the countdown, it means that my people are doing very well. I must commend that team. I also learned that there is an overwhelming appetite for this one-of-a-kind and first of its kind conference, because the number of abstracts that we've received is unprecedented for a conference of its kind. The number of interest that has been indicated, I've had top government officials calling to say we want to be involved, top legislators calling to say we want to be involved, top professors, VCs from across Africa, from across the world saying Dr. Adigwe, what is going on? How do we key in to be part of this? I think by the time we come out with the output of that conference, we would have sort of like recalibrated our epistemologies in providing solution making for African problems.